So this one looks kind of gray and skinny. It has a 1.0 on it. On the back it says tuberculin syringe. So this is the one that we're going to use for the TB skin test. Then I gave you three orange ones. The bigger one is a sub-Q injection needle. So something that we'd use for blood thinners. It comes in milliliters. It has the same needle as the other two. So that's what this one is. But then you have two different kinds of insulin syringes in front of you. One should be a 50 unit and one should be a 100 unit. Depending on what I grab, I'll try to grab the 100. But the 100 unit, first off, it will say U100 insulin on both sides. So you should know that that's the insulin one that we're gonna use for the subcutaneous. The 100 one comes, every line is 2 units. The 50, every line is 1 unit. So in case they give you a 50 while you're practicing, that you know that every one is 1 unit of insulin. This one is 2 units per line. So in front of you, just kind of put the sub-Q and the 100. So we should just have the tuberculin and the 100 unit in front of us. And then the big one I gave out before. This one tells us that it's a 3 ml, 22 and 1/2 inch needle on the packaging. The other ones might say something different, but this is gonna be our intradermal needle. So really, for next week, you'll have 3 needles sitting in front of you, okay? You have the 3 needles, 3 pads, 3 meds, some alcohol wipes. I'm just trying to get rid of as much stuff in front of me as possible. Okay, I'm gonna open up to the. All right, so we'll have this. You will also have your MAR, your patient label. Dale. And here's Dale. You know, same stuff that we had this past week. Name band, the medical history and the vitals, and then the MAR will also be in front of you. So same thing. We're going to look at the past medical history. We're going to read off what the past medical history is. We are going to look at the patient's allergies. What are the patient's allergies? We are then going to look at the physical assessments and what is going on. This time is going to be important because we're going to be giving insulin. So we absolutely have to look at the glucose and make sure that we can do that, right? Because we need to know, are we able to give or are we not able to give? Not to say that the blood pressure isn't important or the pulse or any of that other stuff, but just knowing that we're going down. Then we're going to check each of the medications, or the MAR for the medications that are going to be given. So we could just come over here and we're just going to go to the next ones that are on the list. So we're going to go to regular insulin. Regular insulin, it's subcutaneous with meals, it's due now. Our ondansetron or Zofran intramuscular as needed, and our Tubrsol intradermal 1 dose given now. We're going to plan for no interruptions. We want to make sure that the medications are kept in the wrapper or in the vial the whole time, and we're not going to leave them unattended. So then we're going to pick up our first one. So our first one on here is regular insulin. So you're going to pick up your regular insulin vial, and we're going to see regular insulin. Then it gives you a scale. It's telling you if the blood sugar is between 120 and 180, we're going to give 3 units. If it's 181 to 225, we'll give 7 units. If it's 226 to 350, it's 12. And if it's over 350, we're going to consult the doctor. So then you go back to your sheets. So on our practice sheet of Dale, it tells us the blood sugar is 187. So I would look, 187 is 7 units of insulin. If you have one on your sheet, let's say it's 425, it will say consult doctor. I will tell you how much you will give. So I just want to make sure that you're looking, to put the pieces together. So you have a regular insulin, expires 12 of 2026. I have liquid, it's subcutaneous, and I'm going to give it. All right, my next one is going to be ondansetron or Zofran. I have 12 milligrams on my MAR. My container says 8 milligrams per ml. So if you see a slash, that means per 1 of whatever the units are after that. So per 1 milliliter. So if I did the math for this, 8 is in 1, so every half would be 4. So every half, I would have to give 1.5 mLs for 12 milligrams of Zofran. Expiration 12/2029. I have a liquid, it's due now. Tubrisol. It says 2.5 units, this is where it tries to get tricky, is 0.5 mLs. The reason why it comes that way is whatever this medication is in units, but you draw it up in milliliters, because the syringe will be in milliliters, and I'll show you that in a second. Intradermal, 1 dose, expiration 12/2029, I can give it now. Okay, so we've done the expiration, we've calculated, give me your 6 rights, person, dose, drug, time, route, and documentation. Gather our stuff, we have some needles, you'll have some cotton balls. You can say you need a Band-Aid, I'm not gonna grab any Band-Aids, because we're not really actually giving it. Then we would compare the medication using the 6 patient rights again. So again, we have insulin. I'm going to be giving 7 units. I have medication in the vial, subcutaneous with meals, expires 12/2026. Zofran, 8 and 1 ml. I have 12 milligrams. I have to give 1.5 intramuscular as needed. Expiration 12/2029. It's due now. Tubrisol, 5 units, 0.25, which will equal 0.5. Intradermal, I have medication in a vial, dose is due now. Okay, knock, introduce yourself, hand hygiene, 2 patient identifiers. Can I have your name and date of birth? And then Dale Booth, 3/22/1953. I see you have allergies to pineapple and sulfa. Do you have any others? No. Today I'm here to give you your insulin because you're gonna eat your food, your Zofran because of whatever, and your Tubrisol for that reason. Again, 6 patient, the rights comparing it on the MAR again for our 3rd check. So insulin, I'm gonna give 7 units. Subcutaneous with meals, okay. Zofran, 12.5. I need 1.5, 12/2029. Tubrisol, I'm going to be giving 0.5 mLs. Expiration 12/2029. Then explain, using the drug book, what the meds are. So you're gonna look up those 3 now, and then we're gonna put on our gloves. This is where now we're different, drawing up the medication. So we're gonna all do this together right now. So we're gonna take our first one, insulin. We would ask our person, put their elbow on the table, you know, because we want to be able to have something stable. We're gonna, if they had a sleeve, we could push it up. We wanna expose this area. Look for any hair, any lesions, cleanliness. We're going to measure. Again, you have to tell me, and it tells me, locate area 3 to 4 fingers below the antecubital. So you have to tell me antecubital, and a hand above the wrist in the middle portion. So now we're going to clean off the pad. So the pad we're going to use is a little circle. So we're going to take our alcohol wipe, and we're gonna clean about 2 inches in a circular motion. So just the top of this. And as you can see, they're sticky, so it's kind of rubbing. The next step, I want you to tell me, number 7, I want you to tell me. I don't want you to pull. In real life, we would pull the skin down because if you feel your forearm, it's a little squishy because our skin needs to move. We would pull it taut so we could create more surface tension to put the needle in. I don't want your fingers on the pad doing that. So just tell me that you would pull it tight. I'm gonna inject first. So I'm gonna take off my needle. I'm gonna look to see where the hole or the bevel is up. I'm gonna go at a 5 to 15, and I'm gonna insert the whole thing into there. And you can almost kind of see the needle coming through the pad. I am then going to slowly inject. You can't really see mine, but sometimes you'll get like a little bubble like that's already in the pad, and you're just gonna pull it straight out, and sometimes it leaks right out the pad. Sometimes it'll spray back out at you. I know that, or it pops. That's fine. We're gonna then take this. We are going to recap, place in the sharps container, or we'd activate the safety, and then we would tell them to come back in 48 to 72 hours to have it read. All right, so now you guys can try injecting. All right, intramuscular. So we are gonna position our client, same thing, lesions, redness. This time we're making sure enough muscle tissue, We also wanna see if there's any bony prominences. You are going to tell me, and it says, you must state all anatomical locations, you are going to tell me all three. How are you gonna find the deltoid, the vastus lateralis, and the ventrogluteal? So just exactly how they're stated. Then you're gonna take the pad. We're gonna use the bigger pad this time. I'm gonna do it first. We're just gonna take it, we're gonna clean it off in our circular motion. It tells you for number 6, state how you would use the Z-track method. So I would take the Z-track method, I would push the tissue to the side to create that track. But then it tells you we're gonna uncap the needle. Inform your client you're going to poke them, because they want to know if you're going to. So I'm gonna poke you. We're gonna go at a 90-degree, okay, not a horror, we're not going from here. You just can't go from an inch or 2 above the pad. We're not Michael Myers. We're not, don't do it that hard. So just 90 degrees into the pad all the way. Hold onto the top with your pointer and push the medication in slowly at a rate of 1 ml per 10 seconds. Wait 10 seconds. If you need to, because you're nervous, stabilize it with your other hand, because we don't want it, again, moving all around. We're gonna pick it back up. Don't massage it. Activate your safety. Place in the sharps container. Give our patient a bandage. And then we're gonna move on to the next one. Subcutaneous. So same thing, we wanna expose the site. We want to make sure any lesions, trauma, inflammation. You're gonna tell me the location. So back of arm, stomach, leg, back side of the flank area. If I was to do this, I wanna make sure 1 inch would be a 45-degree angle, 2 inches is 90. I'm gonna say that my patient has 2 inches, same thing. I'm gonna work in a circular 2 inches from the belly button. This is supposed to represent a stomach. If you try to go out on the sides, there's not a lot of pad there. So it's okay if you go a little closer because there's just nothing there. So I'm gonna do my circle. Again, I'm gonna just uncap, tell them I'm just gonna do a 90, so I'm just gonna go straight in. Be careful with these. This needle moves on these pads. These pads are a little stiff, so really kind of dart it in there. In real life, we do. Somebody that you're giving their insulin shot, be nice. Like just kind of like ease it in there. No diabetic wants you to like jab at them. We're just gonna put it in there. Again, we're gonna inject slowly. We're gonna pull it right back out. This time we don't, you know, if there's some oozing, we could touch it. We're going to cap this. Wherever my cap went. We're going to cap it, put it in the sharps. Then again, put our patient in a comfortable position, do hand hygiene, leave. So you can do the other.